first of all, what are we looking for if it is the coronavirus? What do we need to, what's the first thing that's going to alert us about that, Dr. Quinn?
Well, typically the coronavirus has a presentation that can easily be confused with the flu, bronchitis, the common cold, or like you said, pollen allergies. But the deal is, the most important thing to remember is, if you suspect that you have coronavirus, it's a good idea to go ahead and call your medical provider, because most medical providers now are using telemedicine platforms, and they can listen to your symptoms as you give your history, and then they can help you better determine what's going on.
Now, is it best not to, if you've got these symptoms, and since there are so many other things going on right now that could be the same thing, is it best, though, not to ignore that? Check it out first anyway?
Well, like I said, most medical clinics, I'd say 90% now, all of my colleagues are doing it, is highly encouraged by the Mississippi State Medical Association, along with our boards to include the American Academy of Family Physicians, the Mississippi Division, and throughout the country. Most doctors' offices now have telemedicine capabilities. So if you call your medical doctor and have a discussion over the phone, and also we have platforms where you can do video conferences. I talked last week about a patient that I evaluated through the video conference, and the patient had symptoms and signs that I was able to pick up during the telemedicine conference that gave me a high index of suspicion that it was just allergies to the pollen based on the history. But also just want to note, with the coronavirus, it's more common and typical for a person to have a cough. Coronavirus very much affects the respiratory system, and most of the individuals that have coronavirus will have a cough, shortness of breath, and also a fever in most cases. But not to say that if you don't have those specific symptoms, you don't have coronavirus. But the best thing to do and the safest thing to do is go ahead and contact your medical provider so that you can be properly evaluated.
But especially if you've got a cough and a fever, you for sure don't want to delay. You want to contact your medical provider, right? Tell me something about this telemedicine that you're doing now. Is there an advantage? I know that the advantage is because it'll keep you from getting sick. You're not right there with somebody with the symptoms. But is this something that is so advantageous that it's going to hang on after this pandemic is over with, you think?
You know, I feel very confident that it will, because what's happening is the different organizations such as the Mississippi State Medical Association, Dr. Clive Bronson, who's the executive director, he's really been pushing for this to be more accepted. Also, UMC, they have a very aggressive telemedicine program, and they've been pushing, and the different boards, to include the American Academy of Family Physicians and Pediatrics and so on and so on. We physicians have really been lobbying the insurance companies to compensate for these services, because what we've been saying is it is very effective and it can be very helpful, and patients can get better care by having that extra option.
Yeah.
So what's happened is, because of the coronavirus epidemic, we've been forced to use it because we have to try to keep people away from the doctor's office to decrease exposure, and people are getting good care. So I feel that now that it's been demonstrated and proven, it will be around.
I think so. Listen, Dr. Quinn, I appreciate you dropping by like this. And again, like I told the bishop a while ago, one of these days we're going to have a big party here when all of this is over with all the people that we've been talking to via Skype. And we expect you to bring the ice cream, if that's okay.
Hey, I'm looking forward to it.
Good deal. Thank you.